Welcome to the Happy Healthy Chico podcast. I'm Dr. Shane Smith. Come join us as we explore insightful conversations, expert advice, and practical tips on how to live your best life. Let's embark on this journey to wellness together. Hey everybody, Dr. Shane here with Happy Healthy Chico. Thanks for tuning in to another podcast. We're happy to have you with me today. I've got a very special guest. He's a good friend of mine and colleague. This is Dr. Jason Gonzalez. We've been working together for, at the time of this recording, I don't even know.
Since 2010, basically,
10?
like late 2009 or 2010.
Okay.
Yeah, so that's like 14 years.
14? Yeah. So he's a very dear friend of mine, and like I said, a colleague in the profession that we're in. We both are upper cervical chiropractors. It's kind of a niche within the field of chiropractic, and so I figured I worked with this guy long enough. I mean, we call each other brothers now, so wanted to interview him and get his take on kind of his role in doing chiropractic, and then his journey. He's come a long way since I've met him, and wanted to share some of his story with you. So
let's talk story.
Let's do it. So Dr. J, you and we actually went to the same grad school together, but we were at different times. I think I was
almost 2 years apart.
Yeah, a couple years ahead. You were wrapping up school. I was starting the practice.
Right.
We didn't know each other then. But what brought you? Now you were originally from Washington.
Yeah.
So tell me that story.
Yeah, born and raised outside of Seattle, and went to University of Washington for undergrad. And at that point, I probably decided upon chiropractic my sophomore, maybe junior year. I had a background in cycling. I was a competitive cyclist for a long time. When you race bikes long enough, eventually you crash them, and the street always wins.
Right.
So you get beat up pretty good, and lots of road rash, and bumps and bruises, and all that jazz. And so I was often in the office of a physical therapist. My dad would see a chiropractor. I went with him a few times. I started getting into chiropractic care myself when I went to UW, and just something about it always resonated with me. Like, I liked the atmosphere in the office. Everyone seemed happy, and they were very health and wellness focused, which was obviously a big part of my life at that point. Being an athlete, I was trying to maximize my body's performance versus just minimize pain. I feel like a lot of people are out there just trying to keep the symptoms at bay, where I was trying to let me see what this body can do, when it performs at its best, and chiropractic care was a big part of that. When I went to chiropractic college, though, after I decided to go to chiropractic school, I didn't know that there were different types of chiropractic. I thought all chiropractors did what the guy that I saw in Seattle did.
Right.
And then when I got to school, I was like, wait, what? There's different ways you can do this stuff? No one told me that, So that's what got me to chiropractic college. And then once I got into school, I'm kind of a nerd, with glasses and the books and all that stuff. So I kind of went the neurological route, which is another sort of niche within chiropractic. And when I graduated Life West, which is the same school I went to in end of 2007, beginning of 2008, I wrapped up the clinic rotations there. That's what, that's kind of my entry point into the actual clinical practice, was taking a niche within neurological chiropractic, which is a lot of fancy testing, looking at eyes and helping people with, not conditions too unsimilar to what we specialize in now.
Right.
But the way that you would apply it to patient care was a bit confusing, and there never seemed to be any endpoint, and that's what eventually, long story short, led me to this type of chiropractic.
So just so everybody maybe has heard or haven't heard, but yeah, we do what's called upper cervical chiropractic. It's referring to the upper part of the neck, and the reason we work with that area specifically is we focus on nervous system restoration. We're trying to create homeostasis in the body by helping the nervous system regulate itself.
Yeah.
So that's what he's referencing here. But and I may have mentioned this before, but I mean, we're probably in the 1th percentile. 1th is a word, right?
Yeah.
Of all chiropractic. I can't imagine there's more than a couple hundred of us in the country that do this work. So we're a small niche group of people. There's not a lot of us out there. They're hard to find. It's difficult work, but it's really rewarding. So on that note, in all your years of practice now, do you have, I'm sure you've got a favorite story, but is there anything still to this day that just lights you up? What's your favorite part of coming in and taking care of these people? Or
Yeah, I mean, the whole the whole experience is what keeps me coming back, if you want to put it in those terms. Like, what got me into this niche versus, type of chiropractic care was my experience in a general chiropractic care office, different strokes for different folks, right? There's different ways of practicing this thing we call chiropractic. I just had to find something that was going to satisfy my needs as a clinician. And what I enjoy most about this type of work is the objectivity. I was never comfortable in the general world not really knowing when to adjust, when not to adjust, where to adjust. Like, the conversation was kind of, I didn't really pick up on this until I was in practice delivering the case presentation, or sometimes it's called the report findings. And it all sounds amazing, right? It sounds like, oh, it's holistic and we're going to get you well and you're going to see some amazing changes. And in the back of my mind, I was like, yeah, but when do we stop? The story was, come in, no matter what you have, we're going to need to adjust you to get you better. And then, oh, by the way, once you're better, we're going to need to keep adjusting you forever and ever until you get, tired of coming in. And I was never comfortable with that, if I can be honest with you,
And this, just to frame, this is an experience that you would have with not here.
Yeah, with a different chiropractor. So when I got out of school, I was not really well versed in this type of work called upper cervical. It was a class that I took, once in school, and to be honest, it seemed a little too good to be true. Like, we would have, you remember this, we would have presentations every Friday at school. And a lot of clinical docs, practicing docs would come through, and they'd share different cases and stories and, kind of thing. And in many cases, when they had a really, really tough case and nothing they were normally doing was working, what would they always say?
Yeah, they would always say, go after the atlas.
Go adjust the atlas, And maybe for another podcast, we can go in the history of chiropractic and talk about how this type of chiropractic was actually meant to be more or less the only type of chiropractic, but as most specialties, it's hard to do, B, you have to have special equipment to do it properly, which is a big barrier for a lot of people, in 2024, getting your own x-ray and that kind of thing. So I understand why it's not often, we're not, like you said, we're in the 5% or less club in terms of types of chiropractic, which is unfortunate. I mean, the founders of our profession meant this to be the more common type,
Yeah, absolutely.
Anyways, going back to my story, so I didn't like not having a roadmap. The story was always the same. Hey, high five, lay down, let's adjust you, and then we'll see you next Tuesday, and we'll do it again.
Right.
And I was like, well, if we're supposed to be getting people well, should there be like a stopping point to this?
Right.
And so through a series of really fortunate events, I was an associate at a very busy office here in the North State, and there's another associate who was coming through who had a little bit more training on upper cervical work, and he and I would go over cases, and he would say, well, from this perspective, I would do some neurological testing, and I would figure out what's going on with C1 or C2, and I would make a very careful adjustment up there and watch the whole body respond. And I was like, wait, what? Say that again? And to be honest with you, I was doubting my ability to stay in the profession if I just had to keep doing the general stuff.
Sure, yeah.
I wanted to be a master of my craft. I wanted to know what I was doing and why I was doing it, and I wasn't able to scratch that itch with general chiropractic. So I asked him, I was like, well, where do you go learn this stuff? I remember getting a class at school, it was kind of general, and it seemed too good to be true, because here I was studying all the vertebrae in the spine and all the different nerve connections and all these things, and then here's this small group of chiropractors who would be getting super complicated cases well, and they would only mess with the top of the neck. And at that, only occasionally. And I was like, they gotta be just cherry picking their lucky cases and all these things, And come to find out after you dive into it, no, this is like consistently what they see. This is like they get results like that consistently. And I was like, I want to do that. How do you do that?
Right.
And so I went back to the college where I went to and got plugged into a training program for upper cervical. That's how I found you. Thank goodness you were practicing in Chico. And so I kind of shadowed you while I was learning the technique and the ins and outs and the nuts and bolts of this. And right when I was wrapping up the training program, you had an extra room in your office, and I was like, do you mind if I
Let's do it.
Give it another shot here, And so I began to dig my heels into this specialized work, and 14 years and counting, I'm grateful that I did, because it kept me in the profession, and it keeps me interested, it's I still get amazed at what the body's capable of doing when given a chance.
Mhm.
When you approach the problem at a root cause, and there can be more than one root sometimes,
Mhm.
but the nervous system and its relationship with the upper neck is often an overlooked root cause, and
Yeah.
I feel grateful to have a unique skill set that is able to help people. And you can speak to this, that people feel like they have nowhere else to go.
Yeah.
Like, it's unfortunate we're always like we're one of the last rungs on their ladder. They've checked off all the insurance-based things and all the more traditional specialties, and they've been offered question marks or try this medication, or we don't know what's going on with you.
You have to learn to live with it. That's a big one.
Yeah, and we do some functional testing, and we take these unique x-rays, and we're like, your nervous system and this brain stem of yours controls the whole show.
Right.
And right at the top of your neck, you got a problem. I bet you if we took care of that problem, you might see some changes. And
Lo and behold,
way more often than not, that's exactly what happens.
yeah, we do have a pretty good track record. It's I get amazed myself looking back over the years and looking at the people that we have come through the office. And yeah, I mean, I hope one day we won't be at the bottom of the rung, but for now, it is what it is, and I'm still grateful to be a part of it and watch people's lives change. Well, okay, so what about what are the things that make you struggle the most, or what do you have the hardest time with, do you think? And is that going into practice, were the hard things not what you thought they were, or were you surprised by what you thought?
So yeah, so the hard thing, maybe this is my ego talking. One of the hard things is having to convince people. I feel sometimes I have to sell the idea of this.
Yeah.
Because it's a little bit counterintuitive given their experience prior to coming into the office. I mean, it makes a lot of sense once you explain it to them, and that's something people commonly tell us, is like, that makes a lot of sense.
Yeah, totally.
But getting them from the phone to the office, it's unfortunate that our profession has a little bit of an awkward reputation within the public, and in some cases rightly so. But yeah, I think the hard thing is that I have to kind of fight uphill a little bit to get people to be okay with letting us do this,
right?
Because nothing else has worked, so they're a bit jaded,
Yep.
And here we come running to the rescue with our capes on, saying, we have that answer, and they're like, yeah, but no one else has.
Right. Who are you?
And everyone else that I've been talking to is covered by my insurance, and you're not. So,
right.
So that part's a little hard to swallow, and that's just my ego and pride talking. But, and then there are some cases where the scans bear out there's an issue, and the x-rays bear out there's an issue, and they just don't seem to kind of get the results that I want. And I think every profession struggles with cases that on paper it looks like it should be a slam dunk, and then doesn't just play out like that.
Right.
Thank goodness those are not those are the exception, by far and away not the rule.
Right.
But those are the cases that keep me up at night. I've been doing this long enough to expect results. Like I'm surprised when it doesn't work versus the inverse. I'm I'm like, yeah, of course your XYZ is getting better. Like, what did you expect? That's why you're here.
Right.
So I think that's one of the hard parts is cases that don't work out, and those are not very many, but there are some. And then having to get over that hurdle of like I'm not selling you craziness. Like I'm trying to help you.
Right.
I just understand this is from a perspective you're not accustomed to.
Yeah.
But
it is difficult. It wears on you.
Yeah. That's probably the challenging part. And then me, like, you've been working with me 14 years. Like, I'm not a great. I don't like social media. I'm not a big marketer per se.
Right.
My comfort level or my home is like, I want to be in the office, I want to see patients, I want to dig my teeth into the clinical aspect of things. But the world being what it is, like, we have to get our faces out there so people can find us.
Right. Right. Yeah, Jason is what we call an operator.
Yeah.
He likes to show up and do things.
Do the work.
Phenomenal clinician. Obviously I can be braggadocious about him, and I'm biased, but I see what he does with his patient load in the morning. He reviews it, he looks ahead, he's very present with his patients, and observes the case from a distance, and then is actively measuring, are we making forward progress towards the goal that the patient and he have set when they started out on this journey. So it's pretty amazing to watch. I don't know that there's a lot of clinicians that still do that. I forget who I was speaking to. This is years ago. I was trying to describe to this other medical doctor kind of what we do, and he was much older than myself, and he said, "Man, you guys sound like the kind of doctors back in the house call days."
Yeah.
You know, and I really appreciated that remark. But yeah, I think that's the thing that I noticed about Dr. J is that he's not a Facebook guy. You probably won't see him dancing on TikTok. You might not want to see that anyway.
That's
but,
very cringe. That's what my daughter would say.
Oh, and so, but mastered at his craft. So it's been really great to watch him grow and dive deep and really take on some of these tough cases. I take my cases to him if I can't figure it out, and we work together on some of the tougher ones to figure this out to make sure we're making forward progress for the patient. So, okay, well, on that note, you're not a social media guy, you don't do TikTok dances, you work here a lot. What do you do, like, for fun? Like, what do you, like, you're in Chico, so this podcast is about Chico also.
Well, I've got 2 kids, 12 and 8. My son Leo's 12. At the time of this recording, my daughter Lucy, or 9 actually, she just had a birthday, so end of May.
Oh, yeah.
So, I'm doing dad stuff, kid stuff. I just picked him up from summer camp, which is why I'm dressed like this today. We'll go to the park, birthday parties, cow skate, bowling, those kind of things. Personally, I just picked up guitar recently, so I love practicing that. I'm kind of a gym rat. I like to go to the gym, and that's kind of like my personal time. That's where I can let everything go and kind of get out of my head and get more into my body and
for sure
relax. I'm a big fan of reading. I like fantasy, so I've read like Lord of the Rings like probably 15 times and working my way through Dune and that kind of stuff. So I don't know. I guess I'm pretty average dude when it comes to recreational stuff. Not a big fan of yard work. Don't like mowing lawns.
Well, okay. So we're on this note. We'll kind of wrap it up here. I know we're getting close. So what do you do for Jason? Not kids, but what does Jason do to keep himself happy and healthy in Chico?
Yeah, so I would say sun, going outside, like Upper Park, Lower Park, 1 mile, Sycamore Pool. Like I feel way better when I'm outside. I love the office, but it gets a little bit tight and claustrophobic in here when you're spending as much time as I do in here. So right away going outside feels way better. I love the views in Upper Park, letting your eyes see stuff that's way off in the distance. That helps me feel better. Getting lots of sleep. Thank goodness my kids are older now, so I was running low on sleep for a number of years there. But restoring myself with sleep, going outside are probably my 2 biggest ways to like keep myself happy and grounded and able to manage my life better. Like I said, going to the gym is a big one for me. I love I guess it's like an endorphin release or hormonal release, but going to the gym is a big one for me. And then believe it or not, like I'm such a planner, I like to plan free time, if that makes sense.
100%.
Like I plan my days pretty aggressively. We have 2 kids. We've got to plan our family calendar pretty aggressively. So I will plan time to do nothing or do something for fun, whether it's guitar or read or, watch a dude movie or something.
Yep.
But I think it's important to have balance in your life. In fact, that's one of the things I began to appreciate more with clinical care. Is I used to be all about just the work and the nervous system and the adjustments and things, but I'm realizing, having done this for a while, emotional health is super important for someone who wants to be well. I've seen cases in the past where clinically we're getting the job done in terms of the adjustments and the nervous system testing that we do. But I know through talking with the patient, they have a stressful home life or a stressful job, and the effects of that stress wear on their system. And it slows their progress, or there's like a glass ceiling we can't seem to get past. So I've really become to appreciate for myself and for my patients how important it is to learn how to let that tight schedule go and let yourself relax from time to time, because there really is a big tax to pay on your body if you don't, and a massive benefit if you do. And I've seen cases that are able to kind of more healthily process their life and keep things in balance. They get better clinical results.
100%. Yeah, it's critical. Yeah, quite a few of the successful people that I've listened to and met and gone to seminars with, they schedule like every minute of their day, and some of that scheduling is free time to play and do whatever. but there's a start and a finish, because I mean we all know this. If you don't plan it, like if you don't plan a vacation, you're not going to take one.
Yeah.
That's just how it is. So even on the daily, if you can spend a little time being considerate of your downtime and understanding that that's a part of living. Like sometimes the only way you can work on a car is when it's probably not running. You have to turn it off sometimes. You know what I mean? Like, and we're similar. That's when we tend to heal the best, is when we're not running.
Yeah.
So.
It took me a while to figure that out. It took me a while to figure out that downtime is actually necessary for growth and recovery. I used to think that productivity is all where it's at, and you just got to plan every minute every day, but plan every minute every day for work,
right?
or making progress on some front, and that just leads to burnout. And then you begin to get grumpy and irritable, and you actually work slower because you're always distracted.
Yeah.
So now I'm learning. Now that I'm in my mid-40s, I've learned a little bit about life, and planning that free time, planning that downtime is really the only way it's going to happen. Otherwise, you feel that constant pressure to always get more done. That's just the world that we live in, unfortunately.
Well, I think the cool thing, again, this is happy help Chico, and I think the cool thing is we've got plenty of geography around here to plan those activities. That's why I love living here personally, is we got access to so many things. So, so make sure to schedule some downtime for yourself. If you're sick and struggling, maybe give this guy a call. So that's it for our show today, gang. Thank you so much for joining us. We appreciate you, and just stay happy and healthy, Chico. We'll talk later. Bye-bye.
Take care.
19. All right, thanks for joining us on the Healthy Happy Chico podcast. I'm Dr. Shane Smith. Come join us every week where we explore insightful conversations, expert advice, and practical tips on living your best life.